Cystic fibrosis and the CFTR modulators that treat it. Cystic fibrosis is an autosomal recessive disease caused by mutations encoding the CFTR protein. This protein maintains the balance of salt and water on surfaces in the body, such as the lungs. Your options that are CFTR modulators include Kalydeco, Orkambi, Symdeko, and Trikafta. So how do they work? All four of these drugs include a first-generation potentiator which helps the chloride channels on the CFTR protein stay open. Orkambi, Symdeko, and Trikafta also include a first-generation corrector. This helps the CFTR protein become the correct shape and get more of them to the cell surface. Trikafta also includes a next-generation corrector that binds to a different spot on the CFTR protein, working with its first-generation corrector to get even more proteins to the cell surface. Your first option is Kalydeco or ivacaftor. To qualify for this medication, you must be at least 4 months old with one CFTR mutation. This is a first-generation potentiator, and all four of these medications will include the ivacaftor component. Majority of the adverse events for these products come from the ivacaftor. These include headache, dizziness, rash, GI upset, mouth pain, nasopharyngitis, nasal congestion, and upper respiratory tract infections. The next option is Orkambi, which includes lumacaftor and ivacaftor. To qualify for this medication, you must be at least 2 years old with homozygous F508del mutation. This is a first-generation potentiator and first-generation corrector, and its adverse events are the same as Kalydeco, but also include chest discomfort, dyspnea, and productive cough. Your next option is Symdeko, which includes tezacaftor and ivacaftor. To qualify for this medication, you must be at least 6 years old with homozygous F508del mutation or at least one CFTR mutation. This medication is a first-generation potentiator and first-generation corrector, and its adverse events are the same as Kalydeco but tend to be less severe. The newest drug on the market is Trikafta, which includes elexacaftor, tezacaftor, and ivacaftor. To qualify for this medication, you must be at least 6 years old with at least one F508del mutation. This includes the same components as Symdeko with the addition of a next-generation corrector. Its adverse events are also similar to Kalydeco's and are less severe. All of these medications should be taken with a fat-containing meal, and grapefruit should be avoided. If you are prescribed the granules, you mix the packet with 1 teaspoon of a soft food or liquid at room temperature, and this should be consumed within 1 hour. When starting these medications, the liver function should be tested at baseline and every 3 months for the first year. Then it can be checked annually. A baseline and follow-up ophthalmic exam should also be performed. What about drug-drug interactions? These medications interact with CYP3A inducers, inhibitors, and substrates along with PGP substrates. In addition, Orkambi also interacts with oral contraception and immunosuppressants. Still have questions? Ask your pharmacist or healthcare provider for more information on CFTR modulators.
Created using Powtoon.